if you're also looking at leaving the country, we've had healthcare assistants that we have trained, giving our cover letters who have been able to relocate successfully. Also note that you don't have to be in the field to train with us. You can be a banker, you can be anything. You can just be a secondary school certificate holder as long as you're 18 and above to train with us.
Hello guys, welcome back to my channel. I know it's been a long time you've seen my green light on this space, but trust me, it always comes back with a banger every time. For those that just see my face for the first time, hello, welcome, thank you for clicking on this video. My name is Sandra Silvanos and I'm a registered nurse and a content creator living in London. Today, I have got a very industrious colleague of mine, one of those people that I used to look at and be like, I want to be like you when I grow up.
Wow.
She's a colleague of mine, also a nurse. She's working currently in the UK in the same trust as I am. And guys, you won't believe her name is also Sandra. So on the show today, it's Sandra Squared.
Yeah, Sandra
period. So guys, she's got very useful information that will be beneficial to a lot of you, especially for those that are in Nigeria are trying to also relocate. What she's going to share today will be very beneficial to you. What I would advise is that you stay back, get your popcorn, get your snack, and don't miss out on any part of this video because everything we're going to be sharing here is useful information to you. So I'm going to just hand it over to Sandra. Can you just tell us a little bit about yourself? My viewers would love to meet you.
Hey sugars, like she called you. My name is Sandra. I'm a nursepreneur, that's nurse entrepreneur. I'm licensed in Nigeria and also in the UK. I've been practicing for close to 10 years now. As an entrepreneur, I learn every day. I like to learn and grow and accept new challenges to enable me get better. And I'm sure I'll be able to connect with some of you on the same level.
I'm sure you're looking forward to that. So Sandra here has an agency that focuses on home nursing care. Can you tell us a little bit about that? How did you venture into that and what was your inspiration going into home nursing care?
What inspired me to go into home nursing was, the things I've witnessed on the job. There's a need for continuous care, a need to reduce hospitalization, a need to allow clients be able to manage their health conditions at the comfort of their homes. And like we know, there's a growing population, a growing aging population, and with that comes the increase in demand for home care nursing. I've been in situations where I've had loved ones who I would love a nurse to look after because I have other commitments. So what inspired me was also the need to be able to help family members who are committed with work or any other thing to be able to look after their loved ones who cannot be left alone. Those were my inspirations.
So what you're trying to say now is that you have clients that contact you and then you're able to send out your employees to their various homes to care for them?
Yes, we've had clients who have contacted us in Nigeria, in the US, in UK, in Canada, just like you leaving the country to be able to provide a better life for your parents, for example. And they get to call us and say, hey, my mom has stroke, my dad has diabetes, we need a nurse on ground. What we do, we provide nurses to be with our clients 24/7. Meaning if a nurse is leaving, another nurse is coming. We also provide physiotherapy care. So we give you the best bets.
Wow, so it's domiciliary carer here in the UK.
Yeah,
something
very
similar to that.
Yeah, and just like also a support worker, because we have clients who do not have like physical conditions. We have clients who are special needs children as well. We have staff who have been trained to provide care for them.
Amazing. That's very wonderful. You see, bringing the UK standard to Nigeria, this is something to be really applauded. This is wonderful. I think the next thing that myself and my viewers would want to know is what type of services does your agency offer and how can you tailor them, or how do you tailor them to meet the unique needs of each of your clients?
Thank you, Sandy. We provide skilled nursing care for clients who have minor and complex medical conditions. We look after people with chronic disease conditions like diabetes, stroke, cancer. We also provide physiotherapy care. We have physiotherapists who come do their first consultation, begin to have physiotherapy sessions with these people till they recover. And the physiotherapy tools that you require, we also provide for these clients. Yeah, we also provide for these clients. We provide psychiatric care because most people's disease conditions aren't physical. It may not be the stroke you're seeing, it may not be the cancer, it may not be the hypertension. Some people just need people to talk to.
It's more of a psychological
intervention. So depending on the clients we get, that means the nurses that we will get for them. We have people who take care of depressive patients who have become suicidal, who have been suicidal in the past. Their loved ones may not want to leave them alone. We have psychiatric nurses that we deploy to these homes to look after these people. Then another thing we do is we provide care for new moms. Not everyone wants a regular or mobile thing. Not even everyone has someone they can trust with the postpartum care, that the care after delivery. So we have registered nurse midwives who we deploy to homes to help look after new moms and their babies. There was a time I was a new mom. It was crazy. I didn't know the first thing about being a mom. Imagine my baby crying every night. It was crazy because I had nurses on ground who were friends, colleagues, relatives. It was easier for me. So if you're a new mom and you want a specialized care, even alongside the person doing the traditional or mobile for you, you can always contact us. We provide personal care, like when it comes to grooming, generally feeding, parenteral feeding, feeding through an NG, and oral feeding. Ensure that our patients do not have interrupted feeding times. We also provide palliative care. There are clients who have actually come to the end of this journey, and we'll make sure we provide as much comfort as we can for them and alleviate their pain till they meet their maker.
This is really, really amazing. Because there are times when you have like patients in the hospital where, you know, the hospital has gotten to that point where there is really nothing much that they can do at that point, and they're like, okay, it's time to probably take your patient or your relative to a home where, you know, they can be further looked after. And then you don't even really want to do all these things because most times you don't even trust the kind of care they will get in those homes, or sometimes they even tell you, or they want to go back home and just, you know, if they're going to pass on, they pass on from their homes. I think this is, you know, a very good thing that you're doing, because you're being in the comfort of your home, and then you're getting all this care rendered to you depending on whatever you need. And I think this is really, really wonderful. I think this is something that people should really jump on.
And Sandra, one thing we do, you asked about how we tailor our services to meet each client's needs. The first thing we do as trained people is we do an initial assessment of all our clients. We look at your medical history. That's why as an agency, we work with your doctors. We don't just come and change everything. We look at your medical history, your medications. We assess you from head to toe. Then with the initial assessment, we create a customized care plan for you. After we do that, we go into action. Then we always evaluate this care, because if patients could get better or deteriorate, you understand? Like I said. So there are cases where we've had to take our patients to the hospitals where they have been using, and when we take you there, we don't leave you. The nurse is there. I've had clients where our nurses have been ones to even detect that their medications given to them by their doctors were wrong. I'll give kudos to my nurses wherever you are. I'm rooting for you guys. You guys are wonderful. My nurse has called me to say, hey boss, these medications, I don't feel safe to give this client these medications. And I began to look at the medications myself, read more about the medications. I called a pharmacist who works with us as well. Hey, look at this, look at this. I called our doctor that provides medical services during the agency for cases where there's not an emergency. And we all came to the conclusion that these medications should not be given to this client, considering the medical history. We contacted the doctor. Oh, he was happy. He was happy to take the correction. He was happy, and he asked us to withdraw the medication. So this is the reason why you cannot just not work with us. If you're living in diaspora, we are the best people to look after your loved ones.
Very, very amazing. I think for me, what interests me mostly here is the fact that there's individualized care provided. I mean, that is very important, because if you don't focus on a particular patient and their needs, and you're using the general form of care, which is mostly what you find in, you know, homes when you take your relatives there, if you don't have that, then you're not just going to give that patient or that client the best thing. So I feel like this is like one of the catches for me, the fact that you provide individualized care. And there's also something you talked about, like following up the care, even when you have to take them back to the hospital. Don't just leave them there. The care doesn't end there. There's continuity of care, and there's follow-up, which is very, very amazing. So I think the next thing that, you know, my viewers would like to find out, because you are here in the UK with me, and then you've got your agency back home in Nigeria, how exactly do you work towards training your staff, making sure that they're able to provide, you know, the highest quality of care to your clients?
I was really waiting for this question. We have several training methods. They range from online courses like we ensure they have continued education to make sure that they are kept abreast with the recent and latest best practices in the medical profession. We have the classroom trainings. The agency has an office, so we have the classroom training. We also have our hands-on trainings where they have to work with equipment. Because some of these clients have some equipment in their houses. So we train our staff to use this equipment that could just come up on the job. Then we also ensure that we provide our staff with support and feedback in order to make them more confident in their abilities, because these guys are actually very good at their job. We hear from them, we support them as employers. Another thing we do is we evaluate our trainings. If we have trained you in a certain way and on the job you meet something different, you give us the feedback, we'll be able to remove some things, make necessary changes where we need to, just to ensure that our client is getting the best care.
So do you have like a particular range of time where you normally get this feedback or arrange this feedback from your employers? Like maybe every 3 months, like here in the UK in our trust, we have like, I think after every 3 months, there's this thing called like an appraisal where you catch up with your mentor. So do you have a particular time frame where you schedule this, feedback, where you like interact with your workers just to find out what's going on, if they're having challenges? And being here is understandable. You probably have people that are managing for you back home, or you yourself personally probably organize Zoom calls or Skype calls where you catch up with your employer. So what do you have arranged?
Like we know in the nursing profession, we give our reports daily. So with the reports that come to my email, I get to know who I need to schedule a meeting with and how soon I schedule the meeting with them. But I have a very wonderful manager. Kudos to you, baby girl. She's doing a great job back in Nigeria. And at the end of this month, we're actually having a meeting with just one particular nurse because of the peculiarity of the case that the patient he's looking after has. This is to say that if all you need is a male nurse, like you don't want a female nurse, we have that covered. All you need is a female nurse, we have that covered. This nurse is actually a guy, so we have a meeting with him because of the peculiarity of the case, peculiarity of the patient he is looking after. So every month we get to meet with our staff all together and hear the challenges that they are facing. That if it's something that can wait till the end of the month, but if it can't, my doors are open, my email is open, my phones are open. They know they can always reach me. If I don't take my calls, they can reach the manager or they can go to the office when they have the time.
Which is actually amazing because it's not every day you actually have like a CEO that is very open to just any of her employees reaching out to her whenever they have problems. So I think it's a very nice when it makes them open to discussing things, and then you're able to even pick up like issues when they arise because they're able to come up to you to talk to you when they need to. That's wonderful. And the next thing I want to find out is what positions are available within your agency. Do you train healthcare assistants and carers?
We have openings for staff nurses. What we do, we just interview the staff nurses and keep their information because clients come up regularly. Regularly. So right now we have openings for staff nurses. But for healthcare assistants, we train healthcare assistants. We don't really train them in medicine management and administration of some high level stuff, but we train them to be able to do vital signs, chest compressions, that's cardiopulmonary resuscitation, take care of urinary catheters. There are a lot of things that healthcare assistants can learn if they train with us. And when you're training with us, we'll also post you to where you can work, and it'll be a beautiful experience.
You've told us, so you have positions for staff nurses, you have positions for healthcare assistants as well?
Yes, we do have positions for healthcare assistants.
And support workers, because you said something about...
No, our healthcare assistants, they can double up, but we have to train them. We actually do not employ healthcare assistants that we haven't trained. And right now we are actually having a training online that is for free. All you just have to do is pay for your certificate. So when we train you, we bring you on board. There's also a training coming up for care assistants who would like to relocate to Canada. So being with us is like you starting your journey into migration. And the care assistants we're talking about, definitely you don't have to be in the medical profession from all walks.
I was going to ask that question. That was what I was just waiting for you to so I can ask that question. I know many people are trying to relocate to pick up all these healthcare roles, and they don't have experiences, and they're looking for something that can give them that healthcare experience. So I was going to ask for someone who's probably working as an accountant or doing something abstract from the healthcare field. Can they apply for these healthcare positions, healthcare assistant positions within your agency?
Yeah, but like I said, you have to go through our training. When an opening is up, we'll call you. No, you could be asking now. I work from Mondays to Fridays. It could be a part-time training that you could be having. You train online, then afterwards we'll post you somewhere to put together to get some skills. We can even post you to some places that depending on how soon you want to travel. You can decide to change your posting place. It may not even be a client's house. I just know that we'll post you to somewhere where you can gather the physical skills after being trained online.
Okay, so my next question for you is going to be in two parts. The first one is, how can people access your services as service users or clients?
The first thing you need to do is just log on to my website. So the website will be scrolling on your screen right now. When you get there, there's a WhatsApp icon. You just click on it. It takes you straight to our official WhatsApp line where you can communicate with my admin manager. Shout out to you, Lade. I love you. Girl, you're doing a great job. So So she will tell you everything you need to know, ask you the questions she needs to ask you, and let you know what our services entail, what it will cost. And we actually get you nurses in 24 to 48 hours. So there was this client who called and he said the reason he chose us was because we said we were going to get him a nurse in 24 hours. Another organization said they were going to get him a nurse in 7 days.
Oh my god, look at the difference. Look
Yeah,
at the time
and we got him a nurse in 8 hours.
Look at that. Everyone wants that prompt remedy.
Yeah.
I mean, if you have a relative that needs care and you're so busy, you need to go somewhere, how do you wait for 7 days compared to someone that's offering you, 24 hours and ends up delivering in 8 hours? Do you have that information, more information about what you do on your website?
Yeah, there are more information about what we do on our website. You can scroll, just enjoy it, just surf through our website. You will love it. We have more information about what we do there.
So aside from WhatsApp now, is there like an email as well that they can send you mails on? Because some people might not really be comfortable using WhatsApp.
Yeah.
So do you have like an email address where they can also reach out to you for more information?
Yes, so just info@hometendertouch.com. That email comes to me directly and I'll be able to attend to you ASAP. And at the same time, the UK number for the agency will also be on the screen. I'm sure you'll find it on the screen while I speak.
So you have the WhatsApp option, you have the UK number in case you are here in the UK as well and you have relatives back home that need the services provided. You can always reach out to that number. So the second part is how do people access your services, or how do people looking for job opportunities apply to your agency?
Like I said earlier on, we do not recruit those we haven't trained. So our training is something you can be doing no matter how busy you are. Now, being trained by our academy, because aside the agency, we have an academy section of the agency. The academy website is scrolling on your screen right now. Being trained in our academy is like positioning yourself to be able to relocate out of the country. When we train you online, we also post you to either people's homes where you'll be attached to a nurse, a registered nurse, him or her to train you, and you see what the job really is like. Then we have other places we can post you to as well, where you can get your hands-on training after we have trained you online. The same thing, just go to the academy website, click on the WhatsApp icon there, or do me an email with the same email that we have talked about and let me know the training you want to have.
For people that have interest now, they want to send you an email, is there a particular subject they can put? Because you're going to be getting emails from service users as well as job applicants. Is there a particular subject that should be attached to these emails when they send you?
So if you want our services to look after your loved one, the title of your email could be services. But if you just want to get trained and get the certificates, the trainings are going to be coming up. There are more trainings coming up in this month of July.
So where is this agency located? We know it's in Nigeria. Where in Nigeria is your organization located?
The office is in Surulere, Lagos. But when you talk about where we cover as an agency, we cover the whole of Nigeria. So if you're in the east, we'll get you nurses in the east, our mommies and daddies in the east and have their kids in diaspora or in Lagos or also in that same east, but these kids don't have the time to be able to look after these ones. We can get you nurses who will do this for you, physiotherapists who will do this for you.
And the next question, which is what my viewers have been waiting for to hear now, do employers that are working for you, do they stand a chance of being exposed to resources that can help them in their relocation process out of the country? Like what benefits are attached for people that are working under you?
Thank you very much, Sandy. When you're training with us, we also have coaching sessions for you on how to apply for jobs outside of Nigeria. When you're training with us as a healthcare assistant, and also note that you don't have to be in the field to train with us. You can be a banker, you can be anything. You can just be a secondary school certificate holder. Yeah, as long as you're 18 and above to train with us. And we'll have coaching sessions. We're working on training healthcare assistants who would like to relocate to Canada. I think it's starting in this month of July. We're looking at relocating to Canada. Also, we still have the UK in mind, but we all know what's going on with the UK right now. So we're looking more towards Canada and Australia, but more of Canada. So when you have this training with us, we have coachings with you and we position you in your pathway to be able to relocate and join the healthcare system worldwide.
So you also provide certificates that they can present that are also valid, that can use in their application processes?
Yes, we have partners in the UK who, let me leave that information, but we have strong partners. We have strong partners.
We can't give you all the juice, if we give you all the juice here, what's there? What's that mysterious thing that, so okay.
And we have people who have relocated to, who have worked with us, relocate, who have been trained by us. We posted them, we gave them the cover letter. So let's say you don't have a proper cover letter and you think you may have every other thing, you come to us. We know what we can ask you to do. Some other trainings we can ask you to do, so we can get you a cover letter and to enable you travel.
So you've heard it. So aside from providing you services for your relatives in their various homes, you also have, the opportunity to work with them and open doors for you to relocate, provide you certificate, trainings, and a lot more. It's going to help you in your relocation process. And like she already stated, you don't have to even have like a medical background to be able to do this. And that's why they're there, to provide you with those trainings that you need that would guide you throughout your relocation process. So what are you waiting for? You want to jump on this right now. Go and access the link and send a WhatsApp message or send an email to her, or you can even call if you really need it like hot now. So go ahead now and start sending in those messages so that you can jump in on this opportunity. I know it's too early to ask now, and you already said something about it, because I was going to ask if you have plans of opening more branches around the country. Already she stated that she provides services across the whole of Nigeria. All you have to do is contact them. But I'm just asking in respect to having like, your offices in different parts of the state. So you have plans to do that in the future.
Yeah.
And if you're going to open a second branch, let me just poke a little bit. Where are you most likely to open your second office, physical office?
Abuja, Enugu, and Port Harcourt offices are loading.
Okay, good. So you see, we are bringing this thing to your doorstep, closer and closer to you. But like she said, if you need the services, you can contact them and they're able to send out people to whatever location you're in Nigeria. Then physical offices are coming. You can always walk in, still in the pipelines, and they're coming to you very soon. So watch out. I think that covers everything that I have to ask. If there's something else you would like to chip in that you haven't mentioned.
Yeah, it's just my organization is the best bet when it comes to looking after your loved one. You will give them the same love and attention you would if you were physically present. Let us take in all of that burden for you. And when it comes to you training with us, train with us, like I said, and be able to join the healthcare system worldwide. Thank you very much. I'm so excited to have been here.
Thank you so much. It's been a very wonderful and inspiring session. I'm sure you also learned something, as I have learned something, because if I have people that need the services now, I'll definitely refer them, because they are really amazing services provided. Thank you for coming on the show.
Thank you for having me. Thank you.
Thank you so much.
Viewers.
Yeah, it's a pleasure to have had you on here. So guys, I'm going to ask now that you like the video. If you haven't liked it by now, because I'm sure you've enjoyed every part of this video. And I know, you've probably learned one thing or the other, or one person or the other that this, information shared here will be beneficial to, to use the services as a client, or, to work for them as well. So you please share this video to anyone that would benefit from this. And if you haven't subscribed as yet and you want to see more similar content like this, hit that subscribe button and turn on the post notification so that you know whenever I put on new videos like this one. And if you have more questions you'd like myself or Sandra here to answer, you can always leave a comment in the comment box below, or send her a direct message to the email address that we've put up here, or go to their website as she said and send a direct WhatsApp message, and all your questions will be answered. Like I said, leave a comment in the comment section and she will always come back to reply them as well if it applies to her, what you want her to answer. Thank you so much for staying till this part, and guys, we'll see you in our next video.
Take care, guys. Bye-bye.
Bye.
Bye.